We talked to this country's top infectious disease expert, Dr. Anthony Fauci, late this afternoon. We asked him about the children in this country, nearly 100,000 of them testing positive in just the last 2 weeks of July. And we asked him about the images from some schools already, the crowded hallways, many students without masks. And Dr. Fauci made it clear to me that he thinks there should be universal mask wearing in American schools. Dr. Fauci, thanks for joining us here. And I want to start off with the news. We saw these new numbers today, increases in hospitalizations in 20 states, increases in daily deaths in 25 states. And I'm sure you're aware of this new study from the American Academy of Pediatrics. Nearly 100,000 children have tested positive for coronavirus in just the last 2 weeks. And this, of course, comes just as many schools across this country prepare to reopen. Do you feel comfortable with much of the country sending children back to school?
You know, it's really a mixed bag in some respects, David, because we live in a pretty large country that have differences in different parts of the country. I think as a default position, we should try to the best of our ability to get the children back to school for the reasons that we're familiar with about the negative consequences psychologically and otherwise on kids, as well as the spin-off type of a downstream ripple effects on families about getting kids back to work. Having said that, as a default principle, which we should try to do, there's a however there. But the however is that we've always got to make our primary consideration the health, the safety, and the welfare of the children and of the teachers. Now, having said that, if you look at the country, there are parts of the country where the level of infection is really quite low and has been maintained as quite low. Under those circumstances, I think you can't compare them to other parts of the country.
I know what you said there, Dr. Fauci, that we have to take a look at one region at a time. But one thing we can do is look at the schools that have tried to open already. And you've seen those images out of that high school in Georgia, students in the hallways, many not wearing masks, little social distancing. It went all over social media. And now we've learned that 9 students and staff have already tested positive in that school alone. Do those images concern you? And should all students in this country be wearing masks?
You know, I'm one, and I've said it for so long, David, that I really do believe and it's part of what I call a comprehensive way to really avoid the things that you were just referring to. There should be universal wearing of masks. There should be, to the extent possible, social distancing, avoiding crowds. Outdoors always better than indoors, and be in a situation where you continually have the capability of washing your hands and cleaning up with sanitizers. When I see sites like that, it is disturbing to me.
So when you hear this local guidance coming from some schools that mask wearing will be voluntary for students in those schools, you disagree with that? You say universal mask wearing.
You see, the issue is that, you know, it's going to be decided at the local level. I could give you my opinion.
Right. You just said universal wearing of masks.
I feel that universal wearing of masks is one of 5 or 6 things that are very important in preventing the upsurge of infection and in turning around the infections that we are seeing surging.
Dr. Fauci, I know for a long time there's been real concern about the fall and the potential second wave of all this when we have COVID combined with flu season. You've sounded optimistic in recent days, saying Americans in some way might be able to blunt the flu season with social distancing and masks. But we also heard what the head of the CDC, Robert Redfield, said not so long ago. He said, I do think that the fall and winter of 2020 and 2021 are going to be probably the most difficult times that we see in American public health. That sounds a lot different from the optimism from you in recent days. So give us a bit of a reality check here. What should we expect?
Yeah, sure. Well, David, thank you for putting it into that context, because those two things are not incompatible. If we do not do the things in a uniform way that I'm talking about, I totally agree with Dr. Redfield that as we get into the winter and fall, with the likelihood that we'd have a convergence of 2 respiratory diseases, we could have a very difficult time. What I'm saying is that I want to impress upon the American people in a way that's so clear, there are things that we can do that would get the level down. If we go into the fall and the winter, David, with the same situation that we're seeing now, as Dr. Birx described, where you have upticks of % positive, and then you have the inevitable surging of infection.
You have said in order to get this outbreak under control, we've got to get to below 10,000 cases here in the U.S. by the fall. That's just a few weeks from now, and you don't need me to tell you, we're still seeing 50, 60, 70,000 cases a day. So is that goal even attainable in the U.S., 10,000 cases?
I believe that if people, and you're right, human nature, the way human nature is acting out there, it doesn't seem likely. But that doesn't mean it can't be done, because where it has been done, David, it's worked.
Dr. Fauci, you know, whenever we get together here, I always ask you about testing. We're more than 6 months into this pandemic. People still waiting for hours to get tested, then waiting for days for results. So when are we going to get rapid testing for all Americans? I know in the UK, there are reports the government there set to roll out millions of 90-minute rapid tests this week. President Trump just this weekend said we've also been able to send out many more of the tests, which are 5-minute to 10-minute results tests, he said. So where are these tests the president speaks of? Where do you get them? How widely available are they?
Well, I hope they're going to be widely available soon, but we want to make sure people understand the difference is that if we can have screening with those tests and leave the burden of the very accurate tests to be able to do the identification, isolation, and contact tracing, those are two separate tracks and two separate pathways. And I think we can do both of them.
But they're not widely available yet.
No, it's not.
The president's also talked about a vaccine by year's end, by November. He has said at several points along the way. It's really important for folks watching at home for you to give us the bottom line here. Even if we have a vaccine by year's end, what are we looking at with efficacy? What should we be prepared for?
Well, I mean, I think that's part of the good news of things is that if you look at the now at least half a dozen vaccines that we are directly involved with, a couple of them have already last week, a week and a half ago, gone into a phase 3 trial, which means you're determining if it is effective as well as additional safety. The initial preliminary work on that in phase 1 trial, David, have me to be cautiously optimistic. I believe there's quite a good chance that we will, and that should take probably by the end of this calendar year with vaccine available as we go into 2021.
As we go into next year. Just how effective, though, Dr. Fauci, do you think, any one of these vaccines that are showing promise right now could be? What's the sort of reality we should be prepared for, though, when it comes to efficacy?
Well, the statistical analysis, you'd like to show and be able to prove a 50 to 60% effective. I'm hoping that we can do even better than that. I'd like to see 70, 75% or more.
I have no interest, as you know, pitting you against the president, but I have to ask you about messaging for the American people, which is part of your job. The president said again in recent days, over the weekend, in fact, he said that this pandemic is disappearing. It's going to disappear. You're the nation's top infectious disease expert in this pandemic. Are you comfortable with those words, this is disappearing?
Well, there would have to be an addition to that. We could get it to be under control if we do the things that we're talking about. It's not going to spontaneously, by its own devices. We're going to have to act with public health effort. That's the way you get it. I believe it's achievable to get to a level that's quite controlled so that we can open up the country and get the economy back.
But at 50, 60, 70,000 cases a day, it's not disappearing at the moment.
No, it's not. I mean, all you've got to do is look at the data, David. The virus is telling us what it can and will do if we don't confront it properly.
Dr. Fauci with us here late this afternoon on what he believes we still must do as we head into the fall to try to get this pandemic under control. And on universal masks in schools, even though he believes that should be the way, he also made it clear that that decision is up to the states and local school districts.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.